Hi folks, Dr. Ed Beyer, Clinical Director of Beyer Stem Cell Institute in Tinley Park, Illinois. You know, the number one condition that we see by far is arthritic knees, bone-on-bone knees. We see a lot of people that are been told they need total knee replacement, or they've had a total knee replacement on one knee and they don't want to go through that ordeal on the second knee, so they come to us for stem cells. So I decided to do a video to kind of evaluate the case of total knee replacement versus stem cell therapy for the management of arthritis of the knee. First of all, you know, the United States represents 5% of the world's population, yet we consume 72% of the world's pharmaceuticals. The first line of defense from a traditional medicine perspective for any type of pain is pain and anti-inflammatories. Although we use regenerative medicine for many different orthopedic problems, the purpose of this video again is to focus on the number one condition we see in our clinic, which is arthritis of the knee. In a typical medical practice, the first therapy often rendered for bone-on-bone knee or osteoarthritis of the knee is cortical steroids. Now we all know, or it's a well-known fact, that the effect of cortical steroids on inflammation is profoundly good, but at what cost? The pharmacology of corticosteroids is such that it'll greatly reduce inflammation on a very temporary basis, but it immediately starts to break down the structure of the joint. This is why it only lasts so long. It's why your doctor will only do 3 typically in a year, and why it works longer the first time, less the second time, and it decreases. So in essence, corticosteroids does much more harm than it does good for the knee. Another pharmaceutical approach are opioid medications. In the United States, the use of Vicodin and hydrocodone and oxycodone have gone up from 76 million prescriptions in 1991 to 207, almost triple million in 2013, according to the International Narcotic Control Board. Along with this, the incidence of opioid addiction has increased to critical levels in the United States. You know, after the failed approach of corticosteroids and various medications, usually then surgeries are then recommended. The first surgery is usually called a cleanup surgery to remove meniscal tears and tags and such, where the surgeon will go in and actually do that. Once the arthritic process is developed to the point where the femur is resting on the tibia or bone-on-bone knee, a knee replacement is usually recommended. If and when knee replacement is not successful, and we will investigate these numbers, then the patient is recommended pain management, which is usually just more pharmaceuticals and opioid medications. You know, let's investigate a recent study by the British Medical Journal, very respected journal, published in March of 2017. The purpose of the study was to evaluate the impact of total knee replacement on the quality of life in people with osteoarthritis of the knee. 4,498 participants took place in this study, all of which had severe osteoarthritis of the knee. All were between the ages of 45 and 79. This study showed at the rate of total knee replacement in the United States had doubled since the year 2000. Now, this can be explained in part due to the aging population, but due to the fact that this is currently a $40 billion industry, there are many who suspect the rise in surgeries is due to financial gain. This study showed that up to 1/3 of patients receiving total knee replacement still have chronic pain post-operatively. They're very unhappy with the surgery. It also showed that also 1/3 that have total knee replacement may not even be appropriate candidates for this procedure because their arthritis symptoms are not severe enough to merit aggressive interventions. This was also found in another study in the Journal of Arthritis and Rheumatology. This further raises suspicion for financial gain. This study also showed that younger patients are more likely to outlive their total knee replacement and require a second surgery. These second surgeries, folks, are much more difficult to perform for many reasons, including the presence of scar tissue from the first surgery. According to a study in Lancet Journal, which is another very respected medical journal, 35% of patients under the age of 60 will require a second surgery. And are you even considering hip replacement surgery? Well, check this out. A recent study published in PubMed showed that the quality of life from a hip surgery is 1/2 of that of knee replacement. It's even worse. The case of using properly done mesenchymal stem cell therapy in lieu of total knee replacement surgery grows stronger when one looks at the infamous Berkeley-Bedell projection study on joint replacement versus stem cell therapy. Let's look at the total knee replacement side. The average cost is $40,000 to $70,000. A study of 223 patients showed that 17 to 23, or about 20 of them, will suffer serious surgical consequences. That's 10%. Check this out. 1 to 2 will die as a result of the surgery. 1 to 2 will suffer a pulmonary embolism or a blood clot. And 1 to 2 will suffer a heart attack as a result of the surgery. That's almost another 10%. 2 to 11 will require a hospital readmission for serious joint infection as a result of the surgery, meaning IV antibiotics, which disrupts a lot of other things in the body. This number goes up to 22 in the elderly. Also with surgery, there's a lot of downtime, 3 to 6 months of downtime. Now, in the case of stem cells, no serious complications were noted in the study of 223 patients. There were absolutely no complications after a follow-up study of 3 months to 3 years. I personally have had it done on my knee about 3 years ago, and there have been no complications, and my knee is just fantastic. The cost is significantly less, between $8,000 and $11,000 for both knees, and the study found that those receiving properly done mesenchymal stem cells, 89% experienced a greater than 50% of improvement in their pain and symptoms, and of that 89%, 50% experienced a greater than 75% improvement. And these numbers are very consistent with what we're seeing in our institute. So folks, if you're considering total knee replacement, please look into this. In my 33 years of practicing functional medicine, I have never seen anything more effective. If you want more videos, don't forget to subscribe, hit the like button, and share with your friends and family. I'm Dr. Ed Beyer. I hope you enjoyed it. Enjoy the rest of your day.